What is naloxone? Naloxone is a widely available, fast-acting medication that can temporarily reverse an opioid overdose, also called opioid poisoning. Some examples are fentanyl, morphine, and/or heroin, and it allows a person to be able to breathe for themselves again, because when you overdose on opiates, you stop breathing. So the naloxone reverses just that, and you're able to breathe for yourself again. Naloxone is safe for all ages. It does not get someone high and/or cause dependence. An overdose is always an emergency, so if you suspect an opioid overdose, please call 911 right away. Even if you've administered naloxone, all of us should carry naloxone because at the end of the day, we're all at risk of running into somebody that may have overdosed. Some people can overdose on opiates even though they didn't use opiates intentionally. If someone is overdosing, it can be hard to know what they have taken. It will not harm anybody if you do administer it to them and they have not overdosed on opiates. If you are able to breathe for the person while it's taking effect, that's ideal. If you're not comfortable doing that, that's okay. And if that first shot doesn't look like it's doing anything, like the person isn't waking up and they're not breathing for themselves regularly, go ahead and administer that second dose and then wait a couple of minutes again before administering the last and final third dose in your kit. Where can you pick up a naloxone kit? With the BC Take Home Naloxone program, you can pick up a naloxone kit either at your local community pharmacy and/or health center. It's free of charge. You don't need a prescription and you don't need to provide your name. If you operate a private business, you can buy a kit at your community pharmacy.